Hi everyone, welcome to class on medical terminology. We're on week 12 at this point, so about a month out from finals. So today we're just looking at the digestive system. So some quick announcements. This week we have just the quiz due. There were some due dates that were screwed up with last week's assignments, and so for some reason the system had the due dates from last week and all the following weeks. Uh, 2 weeks out from, or sorry, it's a week after where they were supposed to be. So I went and fixed that because of last week's screw up. I left last week's where it was, where it's due, I believe this Sunday. So I wasn't going to change that on you guys because I didn't want to panic. One. Um, there's an extra credit opportunity that I've added. We'll talk about that in a little bit. Um, just looking at some muscle stuff, there's some things that I feel like you guys didn't quite get from one of the assignments that you had. And so I wanted to kind of give you guys an opportunity to get some points back from that assignment and also understand the material. Um, Also, as well, formatting. When you guys are citing sources, this is something that I've noticed as I've been grading recently. You need to cite your sources in the correct format. That can be MLA, that can be APA, whichever format you choose. I'd recommend one of those two, though. Um, but just making sure that you're doing that. Just adding a hyperlink is not citing correctly, and so make sure that you're doing that correctly. And the reason why we do that is because when you cite your information, it allows us to very quickly see, okay, where are you getting this information from and how reliable is this source? So, just having the hyperlink doesn't give us a lot of information. The last thing is, as usual, make sure you guys are reading the instructions. I've had people that are losing points from their assignments just because they're not following the directions. So follow directions, do what it says, and you will get most of the points on the assignment. Yeah. Okay. So looking at the extra credit. So on the muscle uh, discussion board, there was a lot of things. A lot of people didn't quite do this right. So we just want to look at the nomenclature of the muscles. So how I want this assignment done is the first one is an example of how it should be done. So number one, you put the name, biceps femoris. Number two, you have your biceps, then your divisions. Sorry, you have your biceps, which is a division, and you put two because biceps means two heads. Then you look at the other part of the name, femoris. Okay, so femoris is in relation to location. Femoris is referring to the femur. And the last part is putting that all together. So bicep femoris means two-headed muscle located on the femur. Um, the second one I have is an example of what not to do. A lot of people did this on the discussion board. This isn't what you're supposed to do. So they just did just an anatomic breakdown. Biceps femoris. Division, there's two, size, large, shape, long, action. It goes flexion, and then location in the thigh. So that's more anatomy, which is not within the scope of the class. What we're doing in medical terminology is we're looking at words, we're looking at names of things, and being able to say, okay, I understand what that means, what it's saying, and you can infer things from the name or from the word. So if you do the second one, try to turn that in, I will not accept it for the extra credit. The first one, if you do it in that format, one, two, three, the name, what each part of the name means, and then what it all means together. So I'm going to have you guys do 8 of them for this assignment. And so just turn that in on the Moodle page. There'll be a thing on the course that you can submit it. Okay, real quick looking at anatomy of the digestive system. So looking at the form, you have the oral cavity and the pharynx, which then leads to the esophagus. You have the stomach, you have the small intestine, large intestine. And then two kind of other players that you have in that system is the liver and the pancreas. Food doesn't move through those, but they both secrete hormones, or not hormones. They do secrete some hormones, but they just secrete certain enzymes and digestive digestive helpers that help with the full breakdown of foods that we can utilize it. So looking from the physiology standpoint, or just kind of the what's going on. So the different parts of the system are basically for the breakdown of food, the absorption of nutrients in food, and then elimination of waste. So looking at breakdown, so the breaking down of food, so you have the oral cavity to the stomach. And so when you put food in your mouth, you chew it up, which is a mechanical digestion. Your salivary glands also release digestive enzymes that start that digestive process. It goes down the pharynx and the esophagus, and then it goes to the stomach, where you have various enzymes that continue to break down food, as well as acid. And so this acid is responsible for breaking down stuff, and then you have muscles in the stomach that also help with further mechanical digestion, kind of breaking stuff up, making it into almost it's called chyme, but it's kind of it's almost like a paste. Okay. Absorption. So that's the job of the small intestine. So once it leaves once it leaves the stomach, um, uh, acid is neutralized, and you have certain things like bile and other things from the liver that are, you have things excreted from the liver and from the pancreas that help aid with the digestion and absorption, making sure things don't clump together. And so in the small intestine, you have increased surface area. You have what are called microvilli. If you look at a diagram of them and you're reading, you'll see they look like kind of little fingers. And so that increases surface area so that more stuff can be absorbed. And so around the digestive tract, especially the small intestine and large intestine, you'll see that there's a lot of immune defense around it. And so your body puts most of its immune system around the digestive system and kind of treats it like it would the outside, just because you constantly have stuff going in and doing stuff in there. And so it's a really easy place to get bacteria and infection if your body isn't paying attention. And then also with that, you have a lot of circulation going through that area because it's absorbing nutrients and then it's carrying it off to the rest of the body. Okay, last part is elimination. So all that is that's the removal of unusable material. So in our bodies, when we're digesting things, there are certain foods that we can't break down. Fiber is a prime example of this. And so fiber, what it does is it helps move things along in the digestive process. It's super good for you. It's super helpful. But we can't break it down. Our bodies aren't designed to do that. And so uh, in the large intestine, a lot of that stuff is collected, it's moved through. Anything, any excess water or whatever your body wants to keep, it can still remove from there, but it's kind of the gathering point. It's the collecting area. And then once it hits the colon, it is then secreted as waste, which you all know. Okay, that's all I have for this week. Nice and short. If you guys have any questions, feel free to reach out to me. You have my email. So have a great week. Good luck. I'll see you.